How has the misconception and lack of education of HIV affected society?
Nearly 1 in 5 people don't know that they're infected with HIV.
So what is HIV? HIV stands for Human Immunodeficiency Virus, which attacks cells that help the body fight off infections. And without those cells, the body is more susceptible to other.
HIV education can help learners to not only develop and maintain safer behaviors, but also reduce stigma and discrimination towards people affected by and living with HIV.
It is the ethics and morals of individuals which leads to stigma in society. Because of this, many rational minds have indeed been paralyzed by the HIV crisis. Unfortunately, fear and ignorance have resulted in cognitive paralysis to some. The HIV epidemic has resulted in tremendous amount of published report on the biology, transmission, clinical symptoms, and therapy of HIV virus over the last 10 years. Despite this, some people continue to react irrationally to this pandemic. The school-age child with HIV is one group that has suffered as a result of ignorance. The reason for this is the lack of education provided to students in schools. In addition, the misconceptions of teachers when passed on to other children ensure that a new generation is in turn misinformed. One survey carried out by Chive last year found that fewer than half of teachers were aware that mother-to-child transmission is the most common route of infection to children, and more than 50% believe that HIV could be transmitted via spitting or biting. Schools must ensure that a student who disclosed their HIV diagnosis is supported sensitively and professionally. Also, when teachers learn that a child in school is living with HIV, they must understand that there is no risk to others and they should respect their confidentiality.
The relationship between religion and HIV has been an ongoing issue since the emergence of the pandemic. Many faith communities have been involved in raising awareness about HIV, providing free treatment, and promoting HIV testing and prevention efforts. There are many different religions in the world, including Islam, traditional Africa, Judaism, Christianity, Hinduism, and Buddhism. Christian denominations such as Lutheranism and Methodism create World HIV/AIDS Day to educate their people about the disease. Some churches conduct voluntary blood tests and counseling services to diagnose HIV/AIDS and help those affected. When religion does not provide support, it can contribute to negative thinking. For gay men, religion can make it difficult to accept their sexuality. For Africans, stigmatization of people with HIV is a major problem, even within religions. Unfortunately, for many Africans, this means that they keep up quiet about their HIV condition in church or mosque instead of seeking support. They are even afraid to tell their pastor. If they tell their pastor, it will spread and become another stigma. Many Muslims see the epidemic HIV through the so-called prism of sin and a result of sinful behavior, such as prostitution or sex with multiple partners. But at the same time, there is a growing awareness of the HIV/AIDS epidemic in the Muslim community, and efforts are being made to prevent its spread. In Thailand, some Buddhist monks support the use of condoms for HIV prevention. As part of Mechai Varabate's pro-condom campaign, Buddhist monks have distributed blessed condoms to couples.
HIV, often perceived as deadly, disgusting, nasty disease, and most HIV patients are often ignored or neglected just because people are scared of them. But some of that information often put out about HIV is false, and how we can protect ourselves and our loved ones from HIV I believe that the majority of people have once heard that HIV is a gay disease. Well, HIV is a sexually transmitted disease. So any partner, no matter their sexual orientation, that participate in a sexual intercourse which involves unprotected sex would still have a high risk of contracting the disease if the other partner is already carrying it. Secondly, drug usage. Some drug users do share their needles when they are using drugs, and HIV can be transmitted through blood and other bodily fluids, so sharing a needle with an HIV patient might not be the greatest idea. Continuing on the topic of drugs, why is it so hard to find a cure for HIV? The reason is HIV invades and then commandeers the T cells responsible for defeating it. This reduces the number of functional T cells and ruptures their cellular membrane in the process. So always remember to have a protected sex and often get your blood checked with your partner.
Technology. The reason for the rising number of HIV patients in the past is because of the lack of knowledge about HIV and other sexually transmitted diseases. Since most schools still doesn't include sex and hygiene education in their curriculum, teenagers and some adults haven't been properly educated about HIV and sex, so risk can increase. Technology can be a good source to share information about HIV and spread awareness of the problem. Just because we don't know about the problem, it does not mean that the problem doesn't exist. Technology can give HIV patients an opportunity to ask for help, or even find professionals who can help them through their HIV journey. Lastly, technology can give access to knowledge and allow everyone to research and understand the disease.
Are you aware of HIV?
Yes, I am aware of HIV.
Yes, I am.
I've heard about HIV, but I'm not quite sure what it is exactly.
Yes, of course.
Yes, I am very aware of that, but in my community, HIV is a very important disease as we are majority of us are associated with that disease. Yeah.
Do you think that HIV is a global issue?
Yeah, it's it's a global issue, given the number of positive persons across the globe, which is very high. So, to me, I think it's a global issue.
I think it's a global issue because every disease that comes to Earth is a global issue, especially if it's contagious or not contagious. It is a global issue, and if we have any support for people suffering through it, then it's a great thing.
Of course it is. What would you do if you had this disease instead?
I would go consult a doctor, a professional. I would be very aware of myself and I would try my best to protect myself and people around me. Keeping up with my medication.
How do you help people suffering from HIV?
From the scientific point of view, because I have a science background, I do a lot of counseling personally and creating awareness. So whenever, for instance, I meet youths, both in class or outside class, I try to talk about it and incorporate that HIV awareness into my lessons that I teach at school. And when I have interactions with people outside the classroom, both youths and adults, I do share knowledge about HIV, and in that I think I'll be creating the awareness. So
We can't do a lot for the people who have HIV, but all we can do is we can provide them aid if we have any. Like if there are places that support HIV patients, then we can give donations, and I think that would be the most that we can.
So there's nothing that I do personally, but yes, there are ways in which, if for instance something comes up, I could help with is first creating awareness among the youth, the different mechanisms in place, the different bodies there are to reach out to create awareness in those sorts of ways where the youth do not feel that they're left out in some sort of that kind of space. And yeah, so I'm more concerned with, because I'm a teacher, I'm more concerned with the youth. So that's what I'm more inclined to. Yeah.
How can a person catch HIV?
It is obtained either during sexual intercourse with a carrier or sharing of any bodily fluids except for saliva through syringes or something like that.
Where did you receive this knowledge?
In bio class.
Social media, YouTube videos, and I even got a new information from researching on our project.